Welcome everyone to the Dr. Abs Healthcast. I'm your host, Dr. Brian Abasolo, aka Dr. Abs, and I'm really excited about today's show because we have my friend and fellow chiropractic school alum, Dr. Ray Tolmos, who is Miami's first and only board-certified chiropractic internist, or DABCI. He has been in practice for 11 years and has spoken for Biotics Research Labs and Vibrant America Diagnostic Labs. He is the founder of Frontier Spine and Healthcare, a true holistic primary care center. Dr. Tolmos' vision is that Frontier Spine and Healthcare can change the landscape of healthcare in the U.S., providing high-quality healthcare and focusing on predicting and preventing disease by diagnosing the underlying causes of physical, chemical, and emotional imbalances. The DABCI certification is a major part of that vision, and I want to talk more about this vision. So let's bring on Dr. Ray Tolmos. Welcome to the show, Dr. Ray. How you doing, buddy?
Man, I couldn't be better here hanging out with my buddy, Dr. Abs. What's happening?
Good, man. Good. So for those of you who don't know, I actually went to school with Ray. We both went to chiropractic school, Palmer, Florida. Shout out to Palmer. Absolutely, baby. So I'm so happy to have you on the show, man. For those of you that don't know, Dr. Ray is Miami's first and only chiropractic internist, otherwise known as DABCI. So Doc, just explain for the audience, what is exactly a chiropractic internist?
Got you, man. Well, the question that I get asked most often is, do you intern in a chiropractor's office? And that's not the case. What it is that I am a internist, just like most medical doctors that are internists are primary care doctors. So the DABCI is a board certification from the Board of Internal Disorders and Management of Internal Disorders through chiropractics. Yeah, so what we do is primary care, but on a holistic side. So the diagnosis is largely the same, where we use the blood tests, the imaging, the ultrasounds, all that stuff. But the difference is really in the treatment. So we try to help people heal from disease with lifestyle and by finding the underlying reasons for what's going on, as opposed to just diagnosing and then managing later on with medications.
Yeah, I love that, because you just don't focus on, straight chiropractic, which is, the neck pain, the spine, the joints, things like that. You actually go inside the person's body. You send out for blood work, you send out for ultrasounds, MRIs, whatever it may be needed to actually go ahead and treat the person as a whole. So I definitely love what you're doing. Now, obviously, I want to differentiate between what functional medicine doctors out there do, because a lot of those guys, I mean, it's booming. Like, that industry is booming nowadays, and everybody's
big time,
going in for the hormone replacements and all that stuff. And, how does your career path differ from a functional medicine doctor?
Well, that's actually a great question, because while it is somewhat the same, a lot of functional medicine doctors are still using supplements just like medications. So what they're doing is, there's research that shows that melatonin helps reestablish sleep cycles, right? So a functional medicine doctor will then say, okay, well, if your sleep cycle's off, you need, melatonin here. The difference is that what we do is look at, well, why is melatonin off in the first place? And what are the systems that are driving that? And while melatonin may be useful, there may be other systems and other imbalances or deficiencies that may need to also be addressed that cause that in the first place. But for example, if you need blood pressure medication, why? Why did your body all of a sudden lose the control that it once had over its own blood pressure? Yeah. What's the reason that it's going up? It's not because you're not taking enough medication. It's not because of a deficiency of lisinopril. It's because there's a physiological or chemical or combination of those two reasons for it. So we try to identify those and then use the supplements that have been shown to change the way that the body works there.
Got it. Now, what kind of supplements are used in your office and why?
What I'm doing is helping people find out what they need to heal. So for example, you have an old truck or an old car and you want to start working on it, rebuild it, and let's say the engine's working fine, but then you replace a part with a brand new part. And now all of a sudden things start to kind of wear down because that one part is working a lot more efficient.
Overcompensating.
Exactly. So what we try to do is make sure that all the systems in the body are working at the same time, and the supplements help give the body what it's missing or what it needs to do the work of healing. So, people say it all the time, like, oh, cure me, heal me. There's no cure. You have to
Yeah.
heal from within, and that
Yeah.
only comes from the balance that we help people find physically, chemically, and emotionally.
So innate intelligence, man. You get that body to innate intelligence.
Exactly. And that's where the chiropractic part comes in,
Yeah.
because as a medical doctor, it's not that they don't believe the body can heal by itself, but our whole profession is based on the fact that the body's made to heal, right? You hear it's
Exactly.
probably in like every chiropractor's office around there, the power that made the body heals the body, right?
Yeah.
So what we want to do is restore that, because what takes away from that is the stresses that we go through every single day. The more physical, chemical, emotional stress we experience, the farther away that we get from letting our innate intelligence work. And so the chiropractic physically restores that. The supplements and the dietary changes and the things we do there chemically restore that. And of course, stress management and, helping people get organized. And listen, I've had people quit jobs, quit relationships, and toxic things, because at the end of the day, that's part of what their disease or their dysfunction is wrapped up in. So
Oh, wow.
finding that balance is important.
So wait, let time out. So you got them to a certain mental state where they actually dropped all that negative energy that
Yeah,
they
man.
had on.
Yeah.
Have you had any significant others pop in saying like, what did you do to my
What
man? What did you do to my woman?
No, man, no, it's been good. Cheaters hasn't shown up here or anything like
Okay.
that. You know
Okay.
what I mean?
Good to know. Good to know.
No, no, it's been, more so that people realized, hey, look, I'm in a toxic situation
Yeah.
here and
Yeah.
I need to get rid of it. And sometimes people know that, they just don't realize how much of an effect it's having. And
Yeah.
sometimes they just need that person to tell them, hey, look, this is what's up. But a lot of times too, it's just getting people the right care. So if I'm talking to somebody and I'm going through their family history and all of a sudden tears start welling up in their eyes, I'm like, okay, we've
It's a
got
major key. Yeah.
yeah, we've got something that we need to deal here with emotionally, and I'm not trained for that. I'm trained for the internal stuff and the chiropractic. So I have different types of counselors that I refer to for whether it's a long history of trauma or just one abrupt emotional trauma. There's different ways that we can help people there get balance emotionally too.
So take me through the process of, being a chiropractic internist patient where, you like, how do you establish a treatment plan for somebody? Like they walk in and then, how does the whole flow work?
Gotcha, man. So first thing really is taking a very thorough history. So
Yeah.
I sit with people, and the first thing I do is say, okay, give me a laundry list of every symptom that you got. Just give it to me, right?
Yeah.
And then they'll kind of, tell me a few things, and then I say, okay, now give me a timeline. What was the first thing you felt, and when? What did you do about it? Who did you see? What did they do?
Yeah.
What doctors have prescribed what worked and what didn't, and that kind of gives me an idea of where we are and where we need to start looking. So once we finish the history, we do a review of systems and we talk about their body from head to toe. Because again, we're looking at this holistically. Many people that come to see me have seen a gastroenterologist, a rheumatologist, an endocrinologist, a hematologist. They've seen all the ologists out there, and they're all getting different opinions, but all these systems are usually wrapped up in the same
They work as one.
imbalances.
Yeah.
Exactly. And that's the goal, to get them to all work as one.
Yeah.
So that helps me then know where I need to look a little bit further when we're doing their physical exam. So I do a very thorough physical with patients that come in with internal disorders. We check head, ears, eyes, nose, throat, heart, lungs, abdomen, look at the fingernails and look underneath the eyes and really look not just for signs of pathology and growths and cancer, but for signs of deficiency and signs
Yeah.
of imbalances. And then that's how we figure out what test do we need to send for. A lot of doctors send people out for blood before they even come in, but I don't know what to send people for until I talk to them and until I can examine them and see what's going on. So then we send for blood tests, comprehensive stool analysis, food sensitivities, antibody screens. We do a lot of sinus cultures. A lot of people I find have MRSA staph in their sinuses,
Oh,
and
wow.
and their doctors are just telling them take Flonase every day. So again, dealing with the symptoms, but not
Yeah.
the actual problem, right? So we again try to find every infection in the body, every little sign of imbalance, and that's how we then develop the treatment plan. So the supplements, I work with specific companies that, because as everybody knows, the FDA, or there's no regulatory board or authority over the supplemental industry.
Yeah.
So I try to work with companies that do get their supplements and everything third party tested for efficacy, that have the least amount of fillers and excipients and things in there that are going to be detrimental to somebody's health.
Yeah.
The most absorbable forms of vitamins, like certain people need a certain type of B vitamin. There's genetic changes and genetic deficiencies, if you will, mutations that happen that cause people to need different forms of vitamins, and that's something that is not really studied in medicine. That's
Yeah.
more of a functional field, epigenetics. That's why I always say, frontier, the future of medicine, because we're really getting into even how do your cells work on a DNA basis, and what can we do about that.
Yeah.
So it's really cool there.
And what are the main tests that you actually that you see in your practice that you run the most to find out all this information
Mm.
about a person on the inside?
Well, so we do very thorough blood testing. There's a general battery that we use where we do a full iron panel, full thyroid panel, but we also look at the free hormones, T3 and T4. We don't just look at like TSH. One of the big things that we look at also is cardiovascular testing. The lipid panel is just like the tip of the iceberg. What's underneath the water is really how dangerous that iceberg might be, right?
Yeah.
So what we look at is not the values of cholesterol, but all the little pieces that make that up. So cardiovascular risk nowadays, there's no way to assess that on a basic lipid panel. In fact, 50% of people that die from a heart attack as their first sign of any cardiovascular issue have normal cholesterol levels. So the level of cholesterol is not what's important. It's the inflammation and the underlying bits that nobody's really looking at. So we've helped a lot of people turn that around too, but the tests, blood work, stool analysis is probably the next most common thing. I'd say 90% of people with internal disorders. At the end of the day, the immune system is at the heart of most of these issues, and it's what's making other systems work harder or not as efficiently.
Yeah.
So we try to establish that the gut is 80 to 90% of the immune
I
system,
was
right?
just about to say that. I'm sure you're addressing the gut.
100%. So, leaky gut, SIBO, all these things, everybody comes in, oh, they told me I have IBS. What they mean when you have IBS is means that your stomach's not working right, but they don't know what the heck it is that's going on because it's a functional issue. Now, if you have inflammatory bowel, that's different. That means that there's something that's causing your body to, attack its own intestinal lining.
Yeah.
So that's a whole different ballgame. But the symptoms can be very similar. So differentiating that is super important, and we can do that without a colonoscopy for large part, without being so invasive. But a lot of times we'll actually tell people, hey, you do need to go get this colonoscopy. You do need to go and get this endoscopy so we can see what's going on as well. Because I don't just want to see what's happening chemically. I want to see what's happening physically with these structures too. So I send for ultrasounds all the time, thyroid, pelvic. I use all kinds of tests that a lot of doctors actually don't really use much anymore, like ABIs, which are blood pressure testing to look for peripheral vascular disorders. I'm not shy when it comes to ordering tests because we want to make sure there's nothing going on, and if there is, we want to know how bad it is, and in the future we want to know how much better did it get. Like just today I had a patient that came in with psoriasis, and his psoriasis hasn't gotten much better, but he had fatty infiltration of his liver. His liver was like almost double the size it was supposed to be. It was crazy.
Wow.
And then we just got another ultrasound back after a year of treatment, and it's normal in size again. So that was pretty amazing. And it said signs of potential fatty infiltration, as opposed to the liver is enlarged with large amounts of fatty infiltration.
Did his skin condition get better?
It has not yet, but
yet?
his blood work was, when we talked about it, I told him, I was like, listen, I don't see many people that have this many, elevated markers in their serum and this many changes and this many inflammatory things going on. And quite frankly, I'm surprised you feel as good as you do, but he actually told me, he's like, man, I didn't realize I had all these symptoms before. He's like, I'm sleeping through the night now. My energy levels are great. I don't have this crash in the afternoon. I don't have a foggy brain anymore. So he talked about all these things that helped him feel better, productive, sleep better, all those kinds of things. And he's like, look, I came in because of my psoriasis, but I'm still with you, even though my psoriasis hasn't changed, because all these other things have gotten better. And we also identified, he was so happy today when we talked about how his liver had decreased in size and gotten rid of some of the fatty infiltration. He was like, man, I can't believe this. So, that's what it's all about. It's getting function better and knowing that you're doing it by having the evidence that it's there.
Yeah, no, that's absolutely amazing, man. Amazing story. So obviously a lot of people out there, a majority of people have their primary care provider is an MD, but why
Mhm.
would someone want to come to you as their primary doctor? I mean, obviously you've rattled off a list of reasons, at least in my eyes just now, but you know, kind of
Yeah,
like convince people out there that you're the man to see first and
gotcha.
foremost.
All right. Well, my job is never to make myself look better by making anybody else look bad.
Yeah.
And the most important thing that I want people to know is that medical doctors are not the problem. It's not like they all want to just put you on medication for your whole life and they're bad people and they just want to make money for big pharma, like a lot of people make it seem like. It
Yeah.
just happens to be that the system and kind of requires them to be that way. There's a standard of care when it comes to medicine that if somebody comes in with this going on, you need to prescribe this treatment. If that's not done, you lose your license, right?
Mm.
So what's good is that I don't have to prescribe medicine because I don't have that license. So I can identify when people truly do need medicine, and I will tell them that, like, listen, until we can get these things under control, you should be taking this medication prescribed by this doctor. And I'll make sure that they see that specialist if they're not, because medicine can save their life when things really get out of hand.
Absolutely.
But at the end of the day, while you're on that medication, we want to figure out how do we get off of it, because it means that you're unhealthy.
Yeah.
I ask people all the time, are you healthy? And they tell me yes. And then I say, what medications are you taking? And they'll give me a list. And I'll say, well, how could you be healthy but still need all these medications? And then they tell me, well, everything's under control. Well, what if you stop the medication? So that's really what tells us. And by the way, not having symptoms doesn't mean you're healthy either. The only way to know is by running the tests, right?
Yep.
So
Yep.
the basic reason why people would want to see me is that medical doctors are trained to manage disease, not necessarily to help you prevent it. There is no problem until you show up with diabetes. There is no problem until you have a heart attack. There is no problem, well, listen, if your cholesterol's high, you're going to be put on statins. If your blood pressure's high, you're going to be put, and then when does it end? How do you
Yeah.
get better from that, So at the end of the day, we're trying to provide people with solutions and help them identify the reasons why they have these issues. A lot of people, I had one guy come in, he was drinking like a 6-pack of Coke every day, had no idea he was a diabetic. His doctor just didn't run blood sugar. And when he came in, blood sugar is supposed to be, under 100. His blood sugar was like 680 something.
Oh,
And it was,
I mean,
and the
take
guy
a
didn't,
history, man. Like, I find out about this guy's diet. I mean,
anything.
Yeah.
But he didn't even, well, this is the reason why, because he didn't have any symptoms. When he went to go get his annual physical, he said, no, I feel fine. So taking the time to find out about his lifestyle and what was going on, we ran the right tests, we found the right answers, and we helped him reverse, diabetes. He went from a 9.1, something like that, hemoglobin A1C, all the way down to 5.2, and in literally 6 months. So that was unbelievable.
So essentially, I mean, you're doing for people out there what a lot of doctors prior to you haven't done. I mean,
Exactly.
that's amazing.
Well, it's people call it alternative medicine, but we really do what medicine doesn't do at the end of the day, which is look at function. But that's a difficult way to discern things too, because then you say, well, what about a functional medicine doctor? But still, at the end of the day, it's a little, that's better in my opinion, 100%.
Yeah.
I'd rather you be managing conditions with supplements forever than with medications forever. But if you can, but at the end of the day, we still want to heal you. You want to heal, you don't want to have to take 19 different pills every day of supplements either. It's, you take the supplement like a training wheel until you can build enough speed to where your body finds that balance. You can even take your hands off the steering wheel and just cruise, man. That's what health is.
Our body isn't lacking, these medications. Like once you get them into balance, I mean, you want to improve their function. You want them to become better humans, and that strive rather than on all these medications. So I totally feel you on that, man. So that segue, we mentioned the word diet. Ooh. Now, obviously, that's a loaded question. There's a lot of different diets out there. So I just wanted to pick your brain on that. What do you feel is the best diet, or what diet do you usually recommend your patients? Is there a specific one, or is it all tailored to the individual?
Well, what I can tell you is this. I don't know what type of diet to prescribe to certain individuals unless I see a stool test, blood test, that kind of a thing, so I know what their body can handle, both micronutrient and macronutrient wise. But in general, studies have shown that the absolute best diet minus other health issues, just for overall health and cardiovascular prevention, is the Mediterranean diet.
Mm.
So we kind of try to get people towards a Mediterranean diet because what that means is they don't have any other issues. And that's been shown to be the best for longevity, heart health, brain health, pretty much just feeling good and happy and healthy. But we can't start everybody there because they may have issues that won't allow them to.
Yeah.
So really diets, I mean, I use keto diet, I use autoimmune paleo diet, I use the regular paleo diet. I incorporate intermittent fasting a lot, but they all each have their own kind of ways to hack the way that the body's working and what the body's doing. And so we'll recommend that based on certain markers in the stool test and the blood work. Insulin, for example, and blood sugar, we look at those and that'll tell us, do they need fasting? Do they need to limit their carbohydrate intake? Do we need to, take a look at anything in particular? If they have SIBO, we need to put them on low fermentable foods, a FODMAP style type of a diet. That's another one that we use a lot. So again, it all really depends on the findings, on their symptoms, and then what exams we choose, and then what the results of those exams say.
Absolutely, man. So, I mean, in general, what do you see as some of the current challenges facing medicine in general
Oh,
overall?
man. Well, the problem I think that we're having is that everybody really expects insurance to pay for everything. And when we talk about health and wellness, insurance says they don't pay for anything that either improves or maintains your quality of life. So I think the first thing is that people got to look, it makes sense if it's your house, right? Like,
Yeah.
does your house insurance pay you anything if your house doesn't burn down, or if if there isn't a hurricane that wipes it away? Like, are they going to pay you to do landscaping, to make it look nicer and better, and
No,
you enjoy it more?
you're just paying
So
them every month. That's it.
exactly, right. So same thing for our healthcare. It's when things go really bad, right? So if you need medicine, if you have an emergency, but for a lot of these functional things, the insurances don't reimburse what's going on. And a lot of people now, especially with the pandemic and what's going on, are tight on money because they haven't been working. And so cost of the tests is a difficult thing. Stool tests are like $300, and there's nothing we can do about that. And I don't even charge anybody for an additional cost on these tests. That's just what the lab
That's like
charges
bare
me.
minimum cost. Yeah.
Exactly. I'm not making any money on that at all.
Yeah.
You know what I'm saying? Like,
Yeah.
that's just what it takes to find out what people need. So cost is a challenge. And then on the flip side, insurance is a challenge too, because when you have an HMO and you're not paying a lot on your premium and insurance doesn't cover a lot, you're stuck seeing certain doctors, and those doctors may have to see so many people in a day because the HMO is paying them so little that they can't give you the time that you need to really assess your health, your risk,
Yeah.
help you prevent any issues. So, prevention is the biggest thing. We talk about, you get your one annual preventive visit per year. But at the end of the day, if you don't go in there with a lot of complaints or a lot of issues, they're going to look at you and say, oh, everything's okay. You're feeling good. All right, perfect. Well,
Yeah.
here's your clean bill of health for the next year. And then you go back the next year and all of a sudden you have diabetes.
Yeah.
So that potentially could have been prevented if they looked at blood sugar, if they looked at insulin, if they took the time to, ask you about your diet and all those things. So, for me, I spend an hour to an hour and a half usually with a patient on the first visit. Report of findings is a minimum a half an hour. I go through every single little marker and what it means and how it places those puzzle pieces together for us to develop that treatment plan for them. But the challenge is just, man, we're bombarded with stress everywhere we look. We've got 5G now and Wi-Fi and electrical currents everywhere, and pollution in the air, pollution in our food, more importantly. And we don't exercise as much, and we sit on the couch and we drive up to Windows and eat 3 times the amount of the calories we're supposed to. So, and then we're marketed like crazy, low fat this and high, and now this one's keto, but then now it has like all this, you know what I'm saying? So
Yeah. So we're being
everybody
bombarded
trying to
from
make a
the
buck.
inside and the outside. I mean, we're getting
Tough.
hit from every aspect. So what do you
Yeah,
do in
man.
that situation? Obviously, some people don't have insurance, or like you said, their coverage is limited. What if somebody comes into your office and they have, a slew of problems, and they need a certain amount of tests to really be able to see inside this person and see what's really going on and get down to the root cause of the problem? Like, how could you help your patients in that sense?
Well, the first thing that I do is I let everybody know ahead of time, like, look, with what you've got going on, this is what we're going to need to get into. Stool test, $300, a little bit less than that. Food sensitivity might be another 140. If we need to do a specific type of a hormone test, it could be this much, and so I try to let people always know what it is that we need, just to figure out what it is that they need.
Yeah.
And so listen, sometimes unfortunately it's just not possible. And that's why I said that I think it's one of the challenges that we're dealing with, because I wish I could do what I do for everybody without even charging them. But unfortunately, I have a bunch of things that I need to take care of as well here too, to keep this place going and to take care of them. So, it's difficult when you love to do something for somebody, but cost becomes an issue. So I try to work out payment plans. I try to help them as much as I can. As I mentioned, I don't charge anything on top of all these tests. As a lot of doctors charge like functional medicine doctors charge like $2,000 just to, consult with them and for a small battery of tests. And you know what I mean? So for me, it's as affordable as it gets in this field of healthcare. And because I'm the only guy doing what I'm doing here right now, and not a lot of people know about it, especially I'm trying to make it as affordable as I possibly can for everybody. I just want to get the word out that there's another way to take care of your health. And if you feel like you're not getting the best, care, and your doctor doesn't take, more than 6 minutes with you every year, and, you have really no idea what's going on. So that's what I'm here for, to try to help as much as possible.
Absolutely. I mean, if only, people made their health a priority, to increase the function and become better humans. Like I said earlier, obviously financial issues, that's always going to be a problem. If they don't have the means, then it is what it is. But, I think we know that there's people out there that maybe spend their money on something else, and, material items. And it's like, you need to invest in your health, man. Health is wealth. And, unfortunately that's not the case, but
listen, my favorite story is that when I first started, chiropractic, 11 years ago, before I even got into this whole chiropractic internist thing, there was a guy, I'll never forget his name, Augusto, and he would come from like the other side of the county on train, 2 buses, and then like rent a bike to get to the office.
He was committed.
Yeah, man. And like he was there 3 times a week. Like he was like, I'm in. And the guy had nothing, wore the same clothes every day. And then there's people who come in, with the Fendi bags and the Mercedes keychains, and you know what? I'm sorry.
It's like any inconvenience, they're out.
Yeah, I can't do that right now. And it's like, well, is finances the issue? No. Okay, well then what's the problem? I don't know. But at the end of the day, they're not seeing the value in what it is that they're getting.
It's like, I'm literally telling you, you have these issues going on based on these tests, but you don't want to, take the step forward.
But I'll tell you, that rarely happens. I'd say maybe 1 out of every 40, 50 people that comes in don't do anything that I recommend to them, and those are people that generally come in kind of like because their wife forced them to, or, something like they didn't really want to. And then I'm like, all right, you got to change your diet, you got to exercise. They're like, nah, I'm out. Yeah, man.
Yeah, man, it's tough, but I love what you're doing, man. You're doing great things. You're really getting down to the root cause of these people's problems, and that's always been at the heart of chiropractic. And then now you're taking a step
100%.
further as a chiropractic internist. So obviously you're here locally. Let everybody know what your social media handles are. What you got going on, any events, any anything you got going on with the practice. Shout out the practice and just tell everybody where you're at.
For sure, man, for sure. Well, practice is Frontier Spine and Healthcare. We're right in the middle of Kendall on 107th. I do see people remotely. We can do telemedicine as well. I've got patients actually even in other countries, Brazil, Canada, Cayman Islands, all over the place, that have been referred by family members and such. And so on Instagram, we're at Dr. Frontier, as in Frontier Spine and Healthcare. Same thing, you can find us on Facebook, but those pages are kind of, mirror images, whatnot. I have been making it a point to get some more videos coming out. My YouTube is, I believe, YouTube /353 Heal. And I'm coming up with a series now pretty soon talking about what does our blood work actually mean. So it's going to be really educational for people when they get their blood work in and they don't feel well and the doctor says, hey, everything's good. We can kind of give them a little bit of insight on what might be going on there, which I think will be really cool, and I'm really excited about. So Yeah, man, it's about getting the info out. I appreciate you having me on. Dr. Frontier, aka Dr. Ray from Frontier Spine and Healthcare, man, changing the world one spine at a time. But looking a little bit on the inside too. You know what I mean?
Awesome, Dr. Ray. Thank you so much, man. You dropped so much knowledge today, and good luck with your practice. All the success in the world for you, man. Appreciate
Much
you.
appreciated, man. Thanks for having me on,
All
bro.
right. Take care. Have a good one.
You too, bro.